Forgot. Welcome again to the Omni Hypnosis Center. This evening at our monthly workshop, we have an interesting workshop for you. I won't be giving it tonight, and I think you'll find it especially enlightening in an area which is extremely interesting, in spirit possession, attachment, and spirit depossession. We've got a wonderful lady who is going to be giving the workshop this evening who is extremely highly qualified in this area. She studied with Dr. Edith Fiore. She's in from California, and she's settling here in Florida and opening a practice, and it's going to be exciting. She's thoroughly knowledgeable in spirit possession, and as we go through the program, she's going to offer a break somewhere into the program. After the break, we're going to ask one of you, because in order to demonstrate this, we have to have one of you up here that would be willing to sit in this chair and become part of the program. So if you think, after listening, that maybe you could benefit from some of this work yourself, contact us at the break, and we'll sure like to have you up here to work with. So without any further ado, I'd like to introduce our individual who is going to give the workshop this evening. Her name is Tisha Hallet, and she's just going to be fantastic. Let's give her a good Omni greeting.
Thank you. Whoops, I'm hung up already here. Thank you for a warm welcome. And why don't we express some appreciation for what Jerry and Shirley do here. Some very quality training and some bad jokes along the way. Well, as Jerry indicated, this topic will be on depossession. I like to use the term spirit releasing, because too often when you say the word depossession, people think about The Exorcist and Linda Blair spitting up pea soup and her head rotating on her shoulders. And another term could be a spiritual cleansing or spiritual psychotherapy, or the release of discarnate entities that seem to be attached. The concept of spirit releasing is very much like past life therapy. It is not necessary for the therapist nor the client to believe in it for it to get results. So that's important to understand, you know, if you should be working with an atheist and people that there is a key to success in this work. And if you leave with anything, any information, please remember this key. The key that I find is effective in this work is the love in your heart as a therapist and your willingness and wanting to serve the client. And understand that when you do this kind of work, your client isn't the only individual sitting there in the chair. Also, the attached entities are your client, and in which you have to use your therapeutic techniques to help them along. And they tend to be extremely telepathic. They can sense what you're feeling, what you're experiencing. So that key is really an important key, because I find that when that intention is in your heart, it doesn't really matter that much what the words are, what the techniques you use. It really relays a lot on that emotional component that you hold as you do the therapy. Well, since the beginning of mankind, there has always been an awareness of the spiritual aspect of life, as well as the physical and material world. Deities, angels, archangels, demons, agents of the devil, divas of the planets and animal kingdom, gods, demigods, and healing spirits, a myriad of others, and of course the spirit of one who has lived and then has died. Ancient as well as modern literature is rich in the description of what happens in the afterlife and what happens at the point that we call. What causes, or how does it happen, and why does it happen? And it happens a lot. It happens a lot. I use a joke, it's kind of like fleas on dogs. It just happens a lot. Strong emotions generally are what is the grounding force of the individual, which prevents them from making the transition into the light. Strong emotions of anger, fear, jealousy, resentment, guilt, remorse, and even strong ties of love will keep the individual what they call earthbound in here and not make the normal transition. Often you'll find with a sudden or dramatic death or a drug-related death or suicide that this will occur. And the confusion or misbelief on about the afterlife or religious beliefs about hell, for example, will prevent the person from making the normal transition. Also very important to know obsession, whether they be with food or sex or drugs, also seem to draw the entity earthbound, and so that they could attach with an individual who is already indulging in their obsession, or that they can influence to indulge so that they can gratify themselves on the physical senses of the host. Now, an attachment could take place, it seems sometimes just randomly. A person could be open for whatever reason. Sometimes it's just in close proximity of the scene of the accident or the person looking for a safe place or their intention to attach to somebody. More often you'll find a relative could be as simple as a little boy or a little baby wanting to stay with mommy, or a grandmother just wanting to watch her children grow up, or a parent just wanting to watch over you. It could be, you know, very innocent. And they do, at that time, believe that they're here for a good reason. It's important to understand that it's never the way they think, that it's never beneficial to either your client nor the individual that's here. They need to get on with their own life path or evolutionary path, and while they're here, they are, whether they know it or not, harming your client. And I'll get into more of exactly how that takes place. I kind of explain to my clients, well, it's kind of like running 2 cars on 1 battery and never 100%. So this idea of just being in close proximity or compassionate, it does happen. One of the cases that it reminds me of is a woman that came to me, and she had severe headaches. See, she was sitting on this portion of her skull, like just this front area here. And in our session, when going back, as you know, I can use hypnosis to go back to the cause of the headache, she slipped right back into a time period several years before where she was driving and she hit a young boy on a bicycle. And she described that the boy literally flew up in front of her car and came down and crushed his head precisely where she felt the headache. She was a black woman, and she ran around to the black little boy who was dead instantly at the scene. And he described how he was scared and ran to her looking for his mother. And, of course, the most amazing thing about this whole process is that once you help that little individual, for example, the child, who also was associated to many symptoms that she had, kind of a continual stress, that she always felt like she wanted to cry, and in business situations where she would normally feel quite confident, she felt that she couldn't handle it. When the child went home to the light, I like to call it home to the light, all of those symptoms disappear. They're just simply gone. And you'll often find when children are attached that there is, as you can imagine, a lot of fear with being forced, in a sense, kind of go through the situations that adults does. I want to go through some of the books. Okay, let's get down to the 4 areas that were advertised on the flyer. How to detect spirit possession in yourself and others. Before I go through these symptoms, I want you to understand they're simply guidelines. And you'll realize that all of these symptoms can be related to spirit attachment or something else. I think it's important to kind of take the role of the a Dr. Clouseau or an inspector who puts these clues together and then proceeds to find out whether this is truly happening or not. You might even have a case where none of these are present, which is, I've never run into it, but they could still be attached, or maybe they have all of them, and maybe they're not. So use it as guidelines. Mood swings, and we all know how many things can affect mood swings. You might have had the experience of Uncle Joey is a mild-mannered kind of guy, and he has a few drinks under his belt, and he turns into an animal, enraged, ugly person. And sometimes you can actually see their eyes change, their facial features even begin to change as they turn into this angry person. That might indicate that they have an alcoholic entity with them. In the situation where one is intoxicated, their personality becomes recessive and the entity comes forward. Of course, it could just be mood swings like your client, well, I just don't know, I have this rage that's come over me, or this depression come out of nowhere, or I just say these things and I don't even think it's me talking. Listen for the metaphors that they use. Chronic fatigue. Again, I use that example, 2 cars with 1 battery. Very often, a client who is attached will say, no matter what, I can get up in the morning after 11 hours sleep and I'm tired, chronically tired. Of course, again, we know a lot of reasons so one could be tired. That could be one indication. Disturbance with sleep, very often found problems either getting to sleep or awakening around 3 o'clock in the morning. Again, I think that this is a result of the personality becoming recessive in the REM and the entity coming forward, and many dreams that your client will have will be dreams that the entities are experiencing. Now, as I go through these, I'm going to show you how I incorporate them in my pre-talk a little later on, so be aware that these are questions you wanted to discover within your client when you do your pre-talk discussion. Problems with memory and concentration, very often found. They will even have lapses of memory completely, unable to either concentrate, unable to meditate, unable to do the things that they were normally able to do before. Dreaming of the deceased. Dreaming, had a woman come in and she said, well, I had this dream and I was this little child and I was in a house and there were all these windows and I kept trying to get out. And in our process we found that she did have children with her who indeed really wanted to go home. So the dreams could be very revealing. So always, of course, ask about those dreams. I also find that the dreams that the client have the week before they come in to see me are a lot of times related to the situation. I also find another thing that happens is that whether the problem be physical, emotional, or mental, it gets worse a few days before they come in. So they can be doing fine medically, and all of a sudden all of the problems begin to surface. This might be also a clue that the entity is related to the problem that they're experiencing. Of course, one's behavior, addiction, and obsessions, as I mentioned. Uncle Joey could have smoked cigars or a pipe and drank a fifth of a bottle of bourbon all his life, and then he dies in April, and his nephew, for some reason that he doesn't know, begins to drink bourbon and smoke pipe. Be aware that if those kind of onsets of behavior and relationships to addictions could be the influence of someone else. Free-floating anxiety, that one just doesn't know where it's come from, of course, could be related. A woman came to me who, for 4 years of her life, the last 4 years, she was unable to drive on the freeway. Now, my office was in Palo Alto, and it was about 45 minutes to San Francisco. She would take back streets all the way to San Francisco. And when she agreed to drive on the freeway as a passenger, she had to close her eyes or she would go into a full-blown panic. Phobias are often related to people's this kind of problem, so it's important to know how to check it out. When sensitivity to the subject of death, a problem reading the unquiet dead. I used to give clients tapes that described a lot about what I'm telling you tonight, just to kind of give them information and let them become aware. And they would say, oh, I couldn't even get through the whole thing. It just upset me so. And actually, really what's happening there is the entity is is having that emotional and physical reaction within them about their situation. In fact, as you're sitting here tonight and perhaps thinking about being my, my wonderful subject tonight, if you're having a lot of uncomfortableness, if you're really having physical, emotional reactions, tingling, be aware that that might be someone else reacting within you. Also, if you want to leave at the break, question that too. Depression, suicidal tendencies could definitely be related to an earthbound entity. I had a client that I worked with, a woman, and she did quite well with me, and she called me and she says, the last time I saw her, she goes, you know, my husband could really benefit by this therapy. I think that he would really be open to it and benefit from it. I said, well, great, you know, talk to him, bring him in. She called me, I think on a Monday, and she says, my husband is really acting strange. He's just walking around. He's very afraid that something is about to happen. Something terrible is about to happen, and that's all he's doing is walking back and forth and saying something terrible is about to happen, and he aches all over, and he has all this pain, and I don't know what's happening. And it was one of those days that I was working early and working late, and I just couldn't see to squeeze him in. I said, bring him in during my lunch hour tomorrow. And about 6 in the morning, I got a phone call from her from the emergency ward, in which he had then that night taken an overdose of sleeping pills, and he was in critical situation, but they did believe he'd pull through. I told her that when he was home, I didn't want to go and work with him at the hospital because he was really too drugged up at that point, that I would come over and work with him. Well, he went home in a couple of days, and I went over. She told me that while he was at home, he tried to overdose on cough syrup while he was home. So he was, you know, nothing had been resolved. I walked into his bedroom, and he was very pale, very solemn, and I explained the process, and it's a very simple process. We could go ahead and check it out, see if it's happening to you, and he agreed. I found a man with him who was apparently a murderer, and he was running from the authorities, and they had flashlights. It was at night, and it was a number of years ago, by the way. And the last feeling that he had when he was killed was that something horrible was going to happen to me. Something terrible and dreadful was about to take place. At that point, they riddled his body with numerous bullets. And somewhere along the line, he found my client, and he admitted to wanting to get out of the pain, and he felt that if he could help him die, that he would then once and for all be at peace. There was another individual, too, that was creating a lot of havoc. At any rate, these two individuals went into the light. I walked out into the living room, and within about 2 minutes, he got out of bed. His cheeks were rosy. He came out, and he said, I feel wonderful. I feel great. I feel like my old self again. And I said, fine, you get in my office tomorrow. You know, I want to check and see how you do it. And I got calls, numerous calls from his family members saying, it's amazing, the transition that's taken place. It's like he's happy, he's enjoying his family, he is really participating in life in which he was withdrawing from before. How to protect yourself from entities. People like to use the Lord's Prayer, 22nd Psalm. I find that the white light technique is a very good technique to use. I'll describe the light technique and every word of it to you a little bit later on. We have what we know is the gross body, our bones and our skin and our muscles. This is known as the gross body. And then we have a more subtle body, which is actually an oscillating frequency around us, or electromagnetic energy known as the auric field. We also have subtle vortexes of energy known as the chakras. Well, this subtle body is continually fluctuating and oscillating at a different frequency according to what you're feeling and what you're thinking, what you're experiencing, the kind of stresses you're having in your life, and all of these things influence your life. So when people say, oh, I read your aura, they're reading your aura at that moment, but it changes. Now, I call it the invisible shield, because the higher frequency that you can maintain the subtle body, the more impermeable you are to entities. They're oscillating the slower energy. They don't have a physical body, and their energy level slows down. And if you allow your energy level to flow, you tend to be more susceptible because it makes more of a blend. What kind of things can increase the vitality of your energy field? Positive thoughts. Imagining that it's white, because, you know, when you're really blue, you'll see more blues in your aura. It's oscillating at a slower frequency. The darker colors are slower. White light oscillates very quickly. So you can think of the white light, and we all know that as you think, so it is, and you can create the material world around you with your thoughts. Abstaining from drugs and alcohol, whether they be prescription or recreational. These kinds of things will, what they call, drop the auric field or lower it. So when you're in a hospital situation and they give you anesthesia, your auric field is dropped, and there are plenty of individuals without a body looking for a host at that time. I use some creative things. I believe that I have a whole series of guides around me that are specifically placed like guards, and their mission is to detect anybody that would want to influence me. They take them by the hand and take them to the white light, so I don't even have to kind of always be aware of it. I mean, you can get creative. I do a little meditation where before I work. I say the Christ light. I invoke the Christ light within. I'm a clear and perfect channel. The light is my guide. I say it 3 times in a row. Again, these kinds of ideas and thoughts create a higher frequency of your energy field. Now, helping professionals like we are, I call us healers of the mind. We are, in a sense, in an arena where this might happen more to us. Doctors, when I work with doctors, work with plenty of nurses, ambulance drivers, policemen who are always on the scene of an accident, usually traumatic. These kind of people I advise to use more of a preventative measure, which is what I use. I go in and get checked out once or twice a year. I work with Dr. Fiore or Dr. Baldwin, and I just check out and make sure my energy field is clear, because sometimes it can be very subconscious and you're not aware of it all. Sometimes you're very aware of it, but you know, it's best just to check it out and be sure, because you can do all of these things and you can still be attached. Shock, going to a funeral where you feel blue, you feel down, or thinking about your loved one being gone, those thoughts are like pulling on those individuals. They might even come over. I had a case where they just came over. One person was at the funeral, and Uncle Joy, I'll pick on him, came over to just comfort the individual that was mourning, and that person began to feel much better about it. His energy fueled up, and Uncle Joy couldn't leave. Now, that doesn't happen very often. Usually they're here and because they have a real misunderstanding, but it can happen. So I advise people that when they attend a funeral to sure go through the mourning process. It is a natural process that we have to help go through that process, but also be conscious of blessing them and letting them go. It was their time. For my work in regression, we do choose our birth and we choose our exit. The best defense, I think, is knowledge and awareness that this possibly takes place. That's why I admire each and every one of you for being here today, whether you choose to use this therapy or not. Because, you know, being ignorant of it, then the worst, what I find is that my clients, they suffer, the most suffering they do is often not knowing why this is happening to them. And so the knowledge and the awareness that it does happen, and knowing that there is a remedy and you can resolve it if it's happening is also a good way to protect yourself. How to release entities from the house. Now, this happens a lot less than entities that attach to humans. But it does happen. We've all seen poltergeists. And in Edie's book, she goes through how to recognize these things happening. Of course, there could be things flying around or being moved around or lights going on when they should be turned off. You can run into cold spots. You can have them materialize at the foot of your bed. They can knock, make noises, and there are degrees of possessions of houses, just as there are degrees of possessions of individuals. Some of them can be just wanting to play and let you know that they're there. Some of them don't want you there at all, and they'll do all that they can to get you out of there. It can be pretty nasty, that. Because if you have a stubborn entity, you probably would want to work with a professional. Now, what you could do is you could use Edie's induction, and you could make a tape that just basically give them the information that they no longer have a physical body, that they're living in this house, and there's a better place for them, and that's in the light, and instruct them to look over at the light, and that they'll find loved ones that will help them on the way home. And then you can say this in a myriad of ways, and you can just repeat it, get that endless loop that Jerry likes to talk about, and play it while you're... Now we're going to move on to how do you do a hypnotic depossession. I find that a good working knowledge of past life therapy is more often needed than not, so you would want to brush up on those techniques. In your client history, you would ask specific questions, whether there's been death in the family, what they died of, what their name is. Of course, I talked a little bit about, always ask about their dreams. If it were a woman, you would ask whether she's had any abortions, or if their mother even had abortions. Oftentimes, a little baby that had intentions of being here will stay. Ask about their sleep pattern. I say, tell me, how's your memory? How's your concentration? Is it your memory about the same, getting better, getting worse? And they'll say, oh, I can't even keep my mind on anything anymore. They'll tell you. Ask about their mood, depressions. They have suicidal tendencies. Ask them if they've had hospitalization, so that you could then have an inside view of whether perhaps they picked one up in the hospital, even, as young as tonsillitis. There are many entities that join right at birth. So, as you can see, when they've been with you for such a long time, it's very hard to discern what is their experience and what is yours. Okay. The explanation that I give my clients is, I explain to them that the problems that they're experiencing could be something that the real cause could be something that occurred to them, a result of something that occurred to them early on in life. And through hypnotic techniques, we can approach the mind like a computer and go back to the cause and bring this cause forward and understand more about it and then, in a sense, heal it. So that's one area that hypnosis is very effective in uncovering the cause of the symptom that you're experiencing. And they pretty much have a knowledge that that's possible, whether you're talking age regression or past life regression. I say there's a whole other component that's possible, too. And I asked them, have you ever read any articles? Have you read Life After Life by Dr. Moody, where they talk about a person dying and kind of rising above the scene of the death, and then they seem to be pulled to a beautiful light or a religious figure, and they talk about this wonderful experience, blissful feeling that they're experiencing as they're pulling away from the scene of the accident. And they get to a threshold, and they decide they have to do something. They find themselves back into the body, and they will say, yeah, 95% of clients will say, yeah, I've read something like that. This, yes, is really a subconscious memory, because we've all really actually made this transition. I think that research is very important. I think it might really approach what happens at the point of physical death. That it is a physical death. The body falls away, but a part of that person survives: the personality, the consciousness, the spirit, whatever you want to call it. And they agree, yeah. Well, unfortunately, what happens to a lot of these people is that they get lost, or for whatever reason, they stay here. And they attach to people like you and I. And when they do, they bring their emotions and their mental attitudes, their behaviors, and their problems to us. And I would like to check out and see if this is happening to you. It's a very simple process. Would you agree? And then we can eliminate this possibility and then use the wonderful techniques of hypnosis to uncover any other causes to the problem. And then they agree. I've gotten kind of tricky at times and not explained any of this at all. For example, maybe I have a smoking client that does okay for a while, but then he picks up smoking again. And I say, okay, well, why don't we just kind of go deep inside and meet that smoker? Meet that one that doesn't like at all that you've been giving suggestions to yourself to stop smoking. Let's just meet that smoker and find out what that component of you feels like and what it's experienced. And then you'll get Uncle Joey again wanting to smoke. And I'll say, well, this component needs to be healed because Sally wants to stop smoking. She's got too many things to do, and she can't be hampered by all of this problem that smoking causes. So we're going to send you in the light. We're going to be, by the way, giving all the cigarettes you want, if you want. And we just send that part into light. And I just don't even discuss it sometimes because it's not necessary sometimes. More often I do. Because I think it's important for people to be aware, to go inside. And I ask them, I say, you know, I don't ask you to believe me about any of this. I ask you to make your own conclusions about what you think is happening based on the results that you get. When I am talking about the situation to a client, you will often find, or I often find that they begin to respond. Either they begin to get really nervous or teary-eyed, or they experience their heart palpitating. But any reaction that I get, I seize that moment and let that experience become the induction itself. I don't do any induction at all. I just ask them to go inside and experience what they're feeling. Let's say they're having heart palpitations. All right, just tune into that heart palpitation. Let it be okay. And I'll go inside, and if that heart palpitation, sometimes I'll ask for the color of the heart palpitation, kind of use the NLP kind of thing. But I'll ask if that sensation in your heart could speak, what would it say right out loud? And oftentimes that's a beautiful inroad to an entity that is really the heart palpitation. And you will get responses like, go away, leave me alone. Or help me, or I'm afraid. Of course, sometimes you're going to find a real personality change, or sometimes you'll find another language come out of them. Sometimes you'll find a real distortion of the facial features and all kinds of changes. More often than not, it's you know, your client is experiencing and telling you what comes to mind. If I have none of this, then I will then have a light induction. I'll just have them breathe a couple times, and I will then use the light meditation, in which I have them just focus on a beautiful light deep within them, like a brilliant star in the universe, shining outward, filling your entire body with light. Allow the white light to radiate down into your toes, out into your fingertips, moving very beautifully through your heart and up into your head, and all around your body, creating a beautiful bubble or a sanctuary of white light. In the sanctuary of white light, I'm going to ask you to be very aware of any body sensations that you feel, any emotions that you feel, any pictures that pop into mind, anything at all, anything you experience, anything other than neutral interest to what I'm saying may indicate the presence of somebody else reacting. So just go inside, go deeper and deeper inside, become aware of what you're experiencing. And I will then ask them, what are they experiencing? If I know that it's a very strong possibility that Uncle Joey's there, I'll just point blank ask, dear Uncle Joey, are you here? And then you see the tears, or you begin to get Uncle Joey coming through, yes, I'm here. So you're looking for any sensation, sounds, pictures, feelings, anything that pops into mind. I say, even if it's free association, even if you feel like you're making it up, your responsibility is to relay it to me. Try not to edit out anything. Just tell me whatever you're experiencing, and it'll allow me to then surmise what's happening. So the induction, if the feelings or the experience could talk, what would it say? What would be the first thing it would say? So the finding of the entity sometimes is very easy. You can use, if you don't know who is there and they're not having any obvious reactions, you can ask, is there another person here? Is there somebody using this body of Sally? Is there somebody here? You can then repeat that in a lot of different ways. Is there somebody else here besides Sally? Now, if your client says no, know that it's possible for the conscious mind to say no, where the entity is going to respond from the subconscious mind. If you get an answer no, who's saying no? I am. And who is that? And oftentimes you'll really uncover at that point that someone's trying to kind of give you the slip. I often ask the entity, as quickly as I can, to locate your own physical body. Very powerful suggestion. Locate your own physical body. Powerful suggestion in past life therapy as well. Locate your own physical body. Go back to the moment in time, the moments before you left that body. Experience the thoughts, the feelings, the sensations, the last moments of being in your own physical body. If you want, you can take them to a pleasant time in that body before you regress them to the point of death. Once I pass them through that point of death, I even ask, can you recall just seeming to slip right out of that body and just seem to float above it? And maybe you can notice that body lying there, lifeless. If you know the type of illness or death, that's one thing. I've said that before, and the person drowned and there was no body to be seen. It was underneath the water, and when they rose above it, they looked at the water. So, you know, use your own instincts with it. When I have them locate the physical body at that point, or that death scene, I know that at that point the light was there and the helpers were there and the guides were there. So I explained to them that in their confusion and their fear, they simply didn't see these loved ones, but Sally and I are going to offer you an opportunity tonight or today to reunite with your loved ones. Some, perhaps you thought you'd never see again, yet here they are, and I asked them to look for the light and describe the light to me and who they see. And that often is a very quick way to get them to that point of recognizing that the situation. See, sometimes they don't even know that they're dead. They don't even know that they're using somebody else's body. When I have a male and a female, I'll say, look down at this body. There are breasts. There's a vagina. Those aren't your hands. And it was almost like you're kind of waking somebody up out of a dream. Oh, yeah. So making them aware of the condition and situation. Sometimes they're very aware of it, and they're just here intentionally. But making them aware of the situation is a part that would be important. Of course, they're oftentimes confused, and you can help them in a therapeutic and empathetic way. Go through the denial, go through the process of dying, the anger and the resentment, and then into the peaceful acceptance of the situation, and know that the strong emotions that they experience during their death are still very much with them, so you've got to deal with those. I ask that they recognize and know that there is a beautiful place called the home, a really lovely place where all their needs will be met, where they'll be given a time to rest. Understand that these entities are tired. They're lots of times very worn out. And boy, to talk about they can be in a safe place and they can rest is really reassuring to them. By the time the entity is willing to go, I make sure, and this is important, make sure they connect with their loved ones. Some kind of connection. I sometimes ask, is it okay if your loved one comes over and gives you a nice, warm, loving hug? Take their hand, feel their hand. I ask them to hold on to that hand and squeeze it. Feel the bones beneath the skin. Your loved one is in what we call a spirit body. And this is your rightful body. This is a body that doesn't grow old or get sick or get tired, doesn't wear out. And look how youthful and wonderful they look, and they know what they do. So reassuring them that they'll be in a healthy body again is sometimes very reassuring, always reassuring for them. The client must be willing to release the entity. It'll be very difficult for the entity to make the transition. And if you're having difficulty releasing, you got to check in with your client, because those strong emotional needs will pull them here and keep them here, or even pull them back. When you get to the point where they're ready to go, I often use a technique, especially if it's a loved one and a relative, if they're willing to help me help my client. And I'll call upon them to help me detect other entities with the client. Sometimes there are numerous ones. Sometimes there are whole armies of people with them. You can imagine in people's situations where they could be on a battlefield or in a plane accident, and they just kind of come together. And so sometimes they're described just rows of going into the light. So there could be many more than one. I ask that at the end that the client communicate its last words to this individual, and if there's anything that the entity would like to say to the client, do so now. Sometimes this is a very warm and loving expression and asking for forgiveness. because they've come to the understanding that they really had done wrong. When the entity is willing to go, I sometimes will ask the entity to fill the client or the host with light, any areas of the body in which it was hampering or weakening. Depending on the client, I will have them do some blessings and send light. I ask them to receive that energy from the one that's come to help them. Now, before I let them go, which is an important point, I ask the entity to tell me how it has influenced Sally's life. How have you participated in it? Because this is important for the client to know that some of the problems that they've been experiencing have really been the influence of this one that's admitting to influencing their life. I'll ask them sometimes when you have a woman that all of a sudden just is turned off to her husband, I'll ask the man that's with him, well, what do you think about Sally's husband? I don't like him. Or her kids, I don't like them. Well, has this been some of the feeling that Sally's been feeling, that why she doesn't care or can't get close to her children? Yes. These are important things for the client to know before they go. I ask that when the entity connects with their loved one from the light, I say to them, listen to what your loved ones have to say. I'll be quiet. You just listen to them. And they always say the same thing. I don't say a word. I don't tell them what they're saying. When I ask them, what are they saying? Well, they're telling me to come home. They're telling me that I'll be taken care of. They want me to go with them. Always very much the same thing that Dr. Whitman was experiencing almost 100 years ago. So the important part is, of course, to make that connection and to get that contact. And you'll find that your client, in most all cases, will have a complete visual imagery of all of this, even though your client might not be visual at all in the normal circumstances of hypnosis. They will see the helpers that come. They will see the light. It's described as very bright light, but not painful. And when you release the entity, you then ask the client. I ask them, are you aware or could you detect what happened to Uncle Joey? And they will tell you he's in the light. Or maybe he'll say he's on his way, or he's looking back, or any number of things. But you be sure that they've made the complete transition into the light before you stop. Then you can ask your client, how does the light look now? And if the light hasn't reset, it could be indication that there are more there. The light always comes for those who need to go home, and so you then start the process all over again. Once I've completed the session, and even if the light hasn't recessed and they've got to come back for another session, I always use a light meditation that I described. If this is considered spiritual surgery, this light meditation is a salve, and it brings back health into those subtle energies that I talked about before. So I take the client at that point through the light meditation, imagining the white light within glowing out into your body, expanding beyond your body, in front of you, behind you, all around you, and then, once they have that bubble of light, I ask that they imagine a beautiful emerald green sparkling down through your bubble of white light, known by some to be the color of healing. Allow this green vibration to be flushed and penetrate every part of your body that was once being hampered by those who were with you, and let them just kind of enjoy those thoughts. I ask them to imagine a beautiful rose pink trickling down through their bubble of light, known by some to be the color of love. It is the most powerful, the abundant, resourceful energy that we know in the universe, and it is yours, always has been, always will be, yours if freely given to receive. I'm going rather rapidly, but you're going to see this as a demonstration, and hopefully a lot of you have tape. Once I've done that, I explained that I advise them to use this light meditation at least a half a dozen times a day. They can do it in just a few moments to imagine the white light expanding and bringing down the emerald green, the rose pink. Every time they do it, they will be strengthened and they will be healed from the inside out. And then at that point, you can have them open their eyes. I very rarely give suggestions, because I know the changes have already taken place. I might say something in general, like you're going to notice improvements, and none of these improvements lead to further improvements. But I say nothing about the headache will be gone, or that you'll have returned your movement to your arm, or any of that. It just takes place. Often a client will be somewhat surprised and in disbelief. They will usually always express, if you ask them, feeling lighter. And they will often have aches and pains and things like that just instantly gone. So I mentioned before, after this type of work, facial features might change. You might have even a physical change in the way they carry themselves. Lots of changes. They might immediately after the session experience a tiredness. It's kind of like what one would feel after minor surgery or an illness. But within a few days, and this is something that I monitor when I have them come back to my office, within a few days they're feeling a lot more energy, a lot more vitality, and a lot better. Across the board, they generally say, I can make my decisions and move forward in my life quite easily now, where it was very difficult before. These are general things that you'll find, that each client's going to have changes pertinent to the individual influence that they were suffering from. Continuing therapy is highly recommended. Sometimes, depending on the strength of the influence and the length of the influence, they've kind of lost themselves. They don't really know who they are, and you've got to help them build their sense of themselves and their ego and their self-esteem, and they might experience certainly a period of grief, that mourning period that they sometimes didn't really go through when the loved one didn't make the transition. On some level they knew they were still with, and then you say, well, I know my mother's here, I talk to her all the time, kind of thing. Relationships with the family may change a lot. So we're going to summarize here how to do a depossession or a spirit release. Surround your client with white light. Have them be aware of whatever they're experiencing, anything at all. Have them tune into it. Have them describe it. Once you make an inroad or contact with that possessing entity, describe that they are not Sally, they're not your client, and that their body has died. And at that point, of course, I would then recall the time, moments before, the last moments of being in your own physical body. And then at that point, you should have gone into light, but you didn't, and you've joined Sally here, and then describe how this is harming Sally. Sometimes they think that they're here and they're benefiting, but it's never true. Neither one of them are really being benefited. When it is a loved one that's really, really reluctant to go, I tell them how once they go home to light and they get stronger and healthy again, that they'll be able to understand a lot more about the future and utilize rescue workers and helpers, and they can help. You can help your son far, far better from the other side within their prayers and meditations, and when they ask for it, far better than you can by glomming onto them here. And they, again, that intention to stay here and help them, they begin to see that they can help them better from the other side. So that's a good little technique to use when you're having someone that just doesn't want to leave their loved one. Point out that there is a beautiful light. Have them raise their spiritual eyes, and that their loved ones are there. I even had people describe their animals that they love, and that they're in the light there. Might be important, particularly for Catholics, to explain to them that there is no hell, and that there is a priest here to describe and to explain all of this to them if they're having a problem, because they think that they sin and they go to hell, so at least if they stay here they won't go to hell, kind of thing. And then you bless them, go into peace, go into the light with peace, and you have them say their goodbyes. And then, of course, you fill them with the light meditation and describe to them how to do that. Now, there are a lot more intricacies to this that you could get involved in. Doing past lives on the entity that's attached. Doing times when they lived in lifetimes together in which they vowed, I'll always be with you. And in fact, they can stay in an intermediate place, what they call an intermediate, and just hang out until the person comes back again and find them and join with them again. I've only had a record of this about 14 times that they've, each lifetime they've possessed the same soul, but they go up much more than 14 times. Volunteer. Oh, gosh, that's great. Well, that's terrific. I certainly can't work with all of you, but those of you who want to see me can come and get my call, because I think that these problems going on another moment are serious, as all of yours are, but I think that this is an emergency case. Yes? Once again, have Linda describe what she's been experiencing and why she's sitting in this chair. And why don't you just go ahead and tell me again what you have found in your life.
Okay, first of all my life have had an obsession with eating. I was very overweight as a child. I had an abortion 16 years ago.
Did you gain weight at any particular point that you know of from feedback from others?
Let's see. I think it started, well, from pictures that I've seen of myself, it started probably when I was about 10. Well, 10 always comes to my mind. And then on and off throughout the years, except for the last few years.
Anything happened at the age of 10, Linda, that you recall?
I don't know.
Any changes in your life that time moving? Okay.
No.
Okay.
See, I had an abortion. You mentioned about abortion. I had one 16 years ago when I was 21.
Okay.
And then in the last 13 months, I had a baby.
All right. And when you were in the hospital, were you completely out?
When I just had the baby?
Had the baby? Uh-huh.
No, I was into natural.
Childbirth?
Right.
Now you use hypnotic techniques next time. Okay. And
more relaxation techniques I was using, not Lamaze, but another method.
Okay, good.
And matter of fact, Jan was my baby coach.
Okay. And have you had disturbances with sleep?
No, I sleep pretty soundly.
Okay.
I haven't had any problems with that.
Do you have any problem with being tired a lot?
Yes, I've been very tired.
Okay. How about your memory and concentration, Linda? How's that? Is it about the same, getting better, or getting worse?
The last few months, it's gotten worse. As far as concentration, my memory's pretty good.
Okay.
But concentration over the last few months has been bad. I really feel burnt out at my job that I'm doing. And
this is working with retarded children.
Adults.
Adults. Okay.
For the last 15 years, but 9 years in the same position, same agency.
I see. And you've gone through some training lately, huh?
Yes.
Tell people about that.
Okay, just finished the advanced hypnosis course last weekend, and I took the master hypnotist course in June.
Okay. And why don't you relate to the audience what you were telling me about feeling a little bit stifled with getting on with it?
Right. I can't start with the hypnosis. I don't feel like I can move on. Some traumatic things with my job in the last couple of weeks have happened, where I have a conflict with somebody that's my supervisor. We've had conflicts in the past. She's my supervisor for the last 7 months, but we've worked together for 9 years. And it wasn't over, it was only over minor things. And then they asked me to resign without probation or anything like that, but that's gotten worked out through another supervisor over us, who was surprised that somebody would say that to me.
Series of events.
Right, so that, and also relationships. I've always had difficulties with relationships.
What do you mean by
that? With men.
And when you say difficulties?
Having a relationship for a long time. That continues on. I've been married a few times.
Okay. Is there a pattern in the problems that you have in the relationship?
Usually, I pick people that have also had, the first person was an alcoholic, and I had an abortion from, it was his child.
Okay.
And the second one had an eating obsession, where we both had gotten into some kind of lifestyle where we both took care of that eating, problem. I continued on taking care of it. He hasn't.
I see.
And that ended very surprisingly. I didn't think that was going to end that relationship. And then another relationship I got into where I knew I got myself into something offering. Usually I get into patterns if I want to help everybody and take care of them, I guess. That's my main pattern.
Have you had any recurring dreams that repeat themselves? Maybe not exactly, but the theme is the same?
For a while, not recently, but I would have dreams of like where I used to live, where I grew up in Chicago, the house, and where I grew up at.
About 10 years old in that house?
Yes.
And you say your father died of AIDS?
Yes.
And how long ago was that?
He died in March, and he was diagnosed 2 years before.
And his name?
Walter.
And you said someone else close to you?
Yes, my nephew, who was 3 years old, he died.
He was only 3?
Yes, he died suddenly.
And how did he die?
Okay, his was an impacted bowel, they think. They're investigating that.
So no one expected that, did they?
Right.
And your nephew's name?
Alexander.
Were you kind of close to Alexander?
Yes.
Okay. And what was your relationship like with your father in his last period of time, and over a period of time? In a nutshell.
Okay, in the last period of time?
Okay,
since
what's
he
the
was
last
sick?
period of time?
The main thing, I thought of recently was that when I took the advanced hypnosis course, we were talking about, about the deathbed, and I wasn't with my father actually when he died, but like a few days before, and he was telling me a lot of the things because I've always had a lot of anger towards my father. My father, I was related to being a concentration camp survivor. He used to get very angry and hit us and things, yell at us, scream at us, and hit us. So I felt like at that time, people were into abuse at that time, but I think that's what it was, physical abuse and verbal abuse. So on his death, or when I went to speak to him a few days before, he, I remember a few weeks before that, at this point he was in a coma already, but I kept telling him he was a good father, because a few weeks before that, right before he went into the coma, he was like saying that he was sorry that he was such a bad father, and that he was a bad son, and he was a good grandfather though. So.
Your mother is living?
Yes.
Okay. Any other relatives that you close to, grandmother, grandfather?
Not that close. Well, I have a grandmother that's still alive. She's in her 90s, and everybody always says that I'm like her. And then I didn't want to be like her. So that always stuck in my mind all my life. You look like her, you have fat legs like her, like always negative. And she's a very negative person. So I've always worked trying not to be like her.
Okay. Is there anything else that you've noticed while I was talking tonight that you were experiencing sitting there? That you haven't described that you're aware of?
One thing I had mentioned, just going back a little bit, that my parents were my father was a concentration camp survivor. So I think, that whole thing that I feel like I was there, or, I look like my mother's sister, or other people even said, some friends of my mother who...
What's your mother's sister's name? Do you know? Did she die in a concentration camp?
Yes,
And how long ago did she die? Do you know? Approximately?
I don't know which part.
Okay.
It's like, 40s.
40s?
Right, probably, yeah.
So, you're how old?
40. I'm 37.
Do you remember your mother's sister's name?
I think
Maybe it'll come to you.
I think it's Rose.
Okay. Okay. Anything else you want to discuss before we get started? Are you experiencing anything right now? Any tension or any emotion?
Yeah, a little.
A little what?
A little nervous.
A little nervous, huh?
Yeah.
Or do you feel the nervousness in your hands a little bit? Or?
Yeah.
Why don't you just go ahead and close your eyes right now so that you can pay attention to those body sensations. And I want you to know that we're all here as a group supporting you and not only here to learn, here to help. So just feel the chair beneath you right now and know that you're surrounded by people who care about you. And as you listen to my voice, you can just begin by taking a nice, deep, easy breath. And that's good, and exhaling completely. And as you let that nervousness that you were experiencing be okay, I want you just to focus deep within you, Linda. And there's a beautiful white light shining and radiating deep within your solar plexus. Imagine this white light just seeming to radiate out like a beautiful star in the solar system, radiating brilliant white light all through you. Imagine the white light moving down into the tips of your toes. Beautiful white light shining out into your fingertips, moving gently through your heart, and all the way up into the top of your head, out into the ends of your hair, until you're filled with this dazzling white light. Just allow it to comfort you. You can imagine this white light now, Linda, moving beyond your physical skin, beyond your physical body, creating a bubble or a circle of white light around you. And now in the sanctuary and protection of your white light aura, I'm going to ask you to pay particular attention to any body sensations that you feel, Linda. Any voices that come into mind, any images, any thoughts, anything at all as I continue to speak. As I continue to speak directly to any earthbound entity that may be influencing you. And while you've been sitting here, I know that the entities are listening and that they understand that I've been describing much of what they've been experiencing and no one's understood. So I want any entity that may be influencing you to know that I'm here to help them. I'm not here to harm them in any way, and I understand their situation. Now, if you'll just kindly relate to me anything that you experience, that means anything that pops into mind, and just tell me whatever it is, even if it feels like if it's a pure imagination, and I'll know what to do with whatever you relate to me, okay? Do you agree to that? Yeah, good. So anything other than an interest in what I'm saying would indicate the presence of somebody reacting, so now let yourself go deeper inside. That's right, going deeper inside, now becoming aware. Becoming aware. Going deeper inside. And deeper inside. Dear Walter, are you here with your sweet daughter? Dear Walter, are you here? Now, Walter, I know that if you're here, you suffered a great deal in the last moments. Dear Walter, are you here? And anything pop into mind, Linda? Any pictures, anything? Dear Walter, if you're here, I want you to go back to those last moments of being on that deathbed, when you began to think of perhaps some of the things that you didn't do right in this lifetime. Go back and locate your own body at the very last moments, Walter. Discover again what happened to you. Think back, locate your own physical body. And Walter, maybe you can recall that description that I talked about before, just rising above the hospital bed there and seeing that lifeless body lying there. And right at that moment, Walter, there was a beautiful white light above you. And perhaps in your confusion you didn't see it. But right now, Linda and I are going to offer you an opportunity to once again look into the light. Can you see it? Can you sense it? Look around. Yes, there, isn't it? I just want you to notice how warm and how loving and tender that light is. Can you see it, Walter?
Yes.
Good. Now, Walter, standing in that light is someone who loves you very, very much. Someone you haven't seen for a long time, Walter. Perhaps you thought you would never see this one again, but here they are. And they have been longing for you and yearning for you, and they've been so concerned about you. And they're here to help you right now. They just want to help you and show you how important you are and how much you are needed and wanted. Who's here for you, Walter? Do you recognize them? Look into the light. You'll see it. You'll recognize them. Who's here?
I see Celia.
Celia's here, yes. Yes, Celia.
And Linda.
And how are you related to Celia?
She's my wife.
Uh-huh. And who else is standing in the light?
Linda.
Your daughter?
Yes.
Uh-huh. And who else is there? Look into the light. Someone that comes from deep in the light. And their arms are reaching out for you, and they're calling your name. Listen. They're calling your name. Who is it? Reach up. Take their hand.
Daniel.
Uh-huh. Who's Daniel?
My son.
Uh-huh. Daniel's still living, yes?
Yes.
And now these are people who care for you here. And there are others that have made the transition that we call death, that come from the spirit world. And they come specifically for you at this moment to help you in your time of need, Walter. Who is that?
Alexander.
Who is that to you? How are you related to Alexander?
My grandson.
Your grandson. And is he now in his spirit body?
Yes.
Yes, uh-huh. And is he standing in the light, or is he with you by your side here with Linda? Let yourself discover. Dear Alexander, Alexander, are you here? Are you here with Linda? And what would Alexander say?
Yes.
Yes. Yes. Alexander, I know that it was a very quick and sudden situation when you found yourself outside your little body. You didn't know what happened to you, did you? No. What happened to you? Where did you go, Alexander?
I never had a chance.
Yeah, never had a chance. And where was Linda when you found her and joined with her? Do you recall? Do you know how you joined with her, Alexander? How you slipped into her body? Do you recall that, Alexander?
When she found my little car under Nana's car seat.
Mm-hmm. And she thought of you, huh? Yeah. Well, Alexander, I know you must have been very frightened of where to go. No one's explained all of this business to you, that when you die, it's only the physical body that falls away, Alexander. You are an eternal soul. You never die. And when the body gives way, like your little body did, it's time for you to go home and be with all of your loved ones and family that wants you and needs you so much in the light. And there are plenty of places to play and enjoy and have fun in the light. And you do have loved ones that come right now from the light. Alexander, look around. Look who's here for you. Look who it is, Alexander. Oh, my goodness. Isn't that a pleasant surprise? Who is it? Who comes from the light, from the spirit world, to show you how much you are cared for? Who is it? Grandpa. Grandpa. Dear Grandpa, come close. Come close to this child. Hold this child in your arms. Give him that love that he so richly deserves. Alexander, tell me when you can feel Grandpa's arms holding you. I just want you to feel that love. Just feel it. Tell me when you can feel him touching you.
Yes, I feel warm.
Yeah, it's warm, doesn't it? Oh, Grandpa loves you very, very much. You know, he's always wanted to take good care of you. You know that, don't you? Yeah.
He always said that he would be near me.
Yeah, now he is. Yeah. Now hold on to Grandpa, and as you're holding on to him, you're going to feel so much better. And look how good Grandpa looks. Doesn't he look grand? Yeah. Yeah. Grandpa is going to help you go home to life. And when you do, you are going to be in a healthy, strong body again. Now, Alexander, you've been with Linda, and I know that you've never, ever meant to hurt or harm Linda. You love Linda, don't you?
Yeah.
Yeah, she's a wonderful person. But while you've been here, Alexander, how have you felt about her going into a new career that she's just learned about? How has that affected you? Does that scare you a little bit? Dealing with all these people, helping them therapeutically? How do you feel about all that business? Confusing to you? Yeah, it is. Certainly it would be. How old are you, Alexander? About 3?
Yeah, 4 now.
4 now. How else have you been influencing Linda's life while you've been here?
She has a baby now.
Yeah?
Very special baby.
Yeah, she does.
And I'm part of her. I'm part of Carrie Ann.
Uh-huh. So do you sometimes go to Carrie Ann and be with her sometimes?
Yes.
You can join with her too, huh?
Yes.
And have a little body again? Then you can come back and join with Linda sometimes?
Mm-hmm.
Yeah. Anybody else you can join with?
And Jonathan, my brother.
Uh-huh. Who do you stay with most of the time, Alexander?
Carrie Ann.
Mm-hmm.
I make her smile and she laughs.
Yeah.
She's happy.
Yeah, little babies recognize the unseen world, don't they? They know. Well, Alexander, as you've been here, let's face it, it's been a little frightening. No one's even known that you've been here. Have they? No one's talked to you? No one's asked you how you feel about things or what you want to do? Have they? Mm-hmm. And you've been forced to do all of these grown-up things that Linda's involved in. Mm-hmm. And there's a whole fiasco at work. I mean, that's too grown up, and you don't know what's happening with all of that. It must be uncomfortable for you. Besides, Alexander, you belong with someone that can take care of you, someone that can hold you and rock you when you need to be rocked and held, don't you?
Yes. Mm-hmm.
Grandpa's here to do that. Do you feel that?
Yes.
Yes. Now, I'm going to be quiet for a moment. Listen to what Grandpa has to say. You just listen. Listen to what Grandpa wants to tell you. What did Grandpa say, Alexander?
Alexander, you're always my favorite.
Mm-hmm.
You are the first grandchild.
Mm-hmm.
You're a good boy, even though sometimes I told you were a bad boy, but you were good.
Alexander, I want you to ask Grandpa a question. Are you willing to do that?
Yes.
I want you to ask Grandpa, Grandpa, have you come from the light to take me home? And what does he say? Have you come from the light, Grandpa, to take me home? And what's Grandpa's response?
He doesn't know.
Okay, what color is Grandpa wearing? What color is he in?
It's like purple.
Uh-huh. Dark purple?
Mm-hmm. Yeah. Like a lavender. So.
Kind of a lavender, huh? Grandpa doesn't know, huh? All right. I'm going to ask Grandpa, have you stayed here? Have you stayed here since your own physical death, Grandpa? Check and see. Or did you come from the light? Check and see, Grandpa. Have you been here?
Yeah.
Yes, I understand. I know. That's okay, Grandpa. I'm not judging you in any way. As I've said, you know, they didn't educate you about this And when you found yourself outside your own body, naturally I can understand you just wanting to be with your family at that time. So you stayed around your family, Grandpa? Is that right?
Yes.
Okay.
I didn't want to go.
No, I didn't want to go. Okay. Now, Grandpa, as you hold your little grandson, know that you are both in the same condition, that your physical bodies have passed away now. They have died, but you are eternal souls, and when your body gives away, you deserve to go home to the light, where you will be healed and given time to rest and recuperate. And guess what, Grandpa? Guess what, Alexander? You'll be given a choice to come back. Tell me, Grandpa, if you could come back, and when you come back, would you like to come back as a man or a woman?
Man.
Man. Grandpa, have you been with Linda for some time?
Yes.
Yes, you have. Tell me, Grandpa, how do you feel about her getting involved with other men? How does it make you feel?
She can't find anybody good enough for her.
Oh, okay. All right.
She always picks people that are not good for her.
Mm-hmm. All right. Well, she's gonna be better at that now, Grandpa. She's gonna be much better. She's much more perceptive, and she's wiser, and she's stronger, and more intelligent than she's ever been before in her whole life. And now she's able to distinguish those people that are not healthy for her and those people that are in harmony with who she is and where she's going and what she's doing in this world. Do you know that about her, Grandpa?
Yes.
Yes.
I tried to warn her, but she didn't want to listen.
Tell me, Grandpa, how have you been influencing Linda while you've been with her? Come on, Grandpa, fess up. It's important that Linda understand and distinguish her feelings and thoughts from your own, particularly because you've been with her for so long. Tell me, Grandpa, did you like to eat sometimes when she wasn't really particularly hungry? Was that any of your doing? Was it? Yes. Explain that to her. What was Grandpa saying?
I would get angry at you. I would know that you would go eat.
So you tried to stop her from eating, Grandpa?
I'd bring home. I was a baker. I used to bring home all the stuff.
Uh-huh. I see. And so you like to indulge in some of that sugar some of the time, those bakery goods. You baked it. Mm-hmm. You wanted to eat some of them, huh?
Yeah.
Sure. I can understand that. But I think it's important for you, Grandpa, to understand that you have been eating those pastries through Linda, and she doesn't want to eat those pastries. She doesn't want to pollute her body with too much sugar. It's not good for her.
She stopped doing that.
Good. Good. Well, I think that's important for her to understand that during that time, some of this has been you. Tell me, Grandpa, how do you feel? Have you been feeling that it's hard for you to move on?
Yes, I'm punishing myself for all the wrongdoing I've done all my life.
Well, Linda has a whole new threshold she's going into, and she cannot afford to carry your burdens and your disappointments and your fears into her new career. She is going to be one excellent therapist. She's going to help a number of people, and she now needs all of her individual power and confidence to do this. She cannot afford to carry you around anymore. And besides, Grandpa, there's a much better place for you, and that's in the light. Raise your spiritual eyes, Grandpa. Raise them. Look at that beautiful light. And look who's here for you. Look who it is. Someone that you respect and love very much. And someone that cares for you very deeply. It is a loved one. Someone that you recognize. Who is it, Grandpa? Who is it? Recognize them. Let them move closer. Is it okay if they come closer to you, Grandpa? It's been a long time. Come close, loved ones. Come close to Grandpa. It's been a long time. Come close. Feel their touch, Grandpa. You'll feel their touch. It's warm, as you described before. Feel the touch. Who's here for you? Who is it?
It's a lot of people.
Yeah. Are they coming from the light?
Yes.
Yeah.
They're trying to. It keeps like flashing, and it's dark and it's light.
Mm-hmm. And who is at the head of the group? Who's standing there? Someone that you recognize calls your name from the light. Reaches out for you. Who is that, Grandpa? Calling your name now.
It's Alexander.
Alexander's here with you, yes. He's here with you. He's here with Linda.
And my brother.
And did your brother pass into the spirit world?
Yes.
What is your brother's name? Is his grandpa's brother?
Yes.
No.
And one of my two brothers, they died.
Yes. Your dear brothers are here for you. They're here for their brother. And they're here to help you on the pathway home. And they want to just show you all the glorious, positive things that are in store for you by coming here and showing you how wonderful they look and how happy they are and how much they want you to come home. Hold on to your brother's hands. Feel their love. Feel their concern for what you've gone through. Can you feel them, Grandpa?
Yes.
What does it feel like? Feel, come, dear brothers, come close. Give them a nice, warm, loving hug. It's been a long time for Grandpa. Come close. And feel your brother's love around you, Grandpa.
It feels warm and numbing.
I want you to ask your brothers, Grandpa, if they've come from the light to take you home. What did they say? Ask them point blank, have you come from the light to take me home? What did they say?
Yes.
Yes. Would you like to go home, Grandpa? I know you've grown tired and frail. It's been weary for you lately, yes?
Yes.
Yes. Understand that Linda's been experiencing a lot of your weariness and tiredness and just wanting to give up. Do you understand that, Grandpa?
Yes.
And when you go home, with your brothers, to your family, to those ones that care about you, Linda is going to feel so much stronger and better to carry on with her life. Isn't that good to know?
Yes.
And there's something else that you can do, Grandpa. You can help little Alexander find his way home on the path to enlightenment. Doesn't that make you feel good, Grandpa, to be able to do something like that? It truly is God's work. And you're participating in it. Yeah. Grandpa, hold your brother's hands. Feel that love. Feel that love. Unconditional love. Feel the warmth. But it makes you feel better than you've felt in a long, long time. And before you go, Grandpa, I'm going to ask you, would you be willing to help me help Linda? I know that you can. Good. Holding on to your brother's hands infuse you with energy, and Grandpa, you can be my flashlight, my x-ray eyes into Linda. And I want you to just shine your awareness now with your brilliance and understanding. And look all the way through, all the way down into Linda's legs. Is there anybody there? Is there anybody hiding? Is there anybody afraid of going like you once were, Grandpa? Check and see. Okay, take your time. We're in no hurry. All right, Grandpa, look up now into her female organs, where she once carried that little baby that she had to, at that time, abort. Is there anybody there? Is there anybody hiding? Yes. And if you could describe it, what would it be like, Grandpa? Where is it located? Down in her female organs?
Right now in
had a color, if it took on a color, what color would it take on? If it could take on a color, what color would it be?
Black.
All right. I'm talking to the black one here with Linda in the base of her back. I'm talking with you. I'm speaking with you. What is your purpose for being here? And what would the black one say? First thing that pops into mind.
I'm stuck here, caught here.
Uh-huh. Uh-huh. You're caught here. And while you've been caught here and stuck here, tell me, black one, have you ever had your own physical body? Check and see. Have you ever had your own physical body, black one, before you were stuck here? First response.
No.
No. Okay, black one. And how have you influenced Linda's life while you've been here? What are some of the ways that you've participated in her life?
Causing stagnation. You know, holding her back.
Holding her back, yes. Not letting her move on. How long have you been here with Linda?
I just come on and off. Usually around the time that she has her period.
So you've been contributing to some of that discomfort? Been able to cause her a lot of pain?
Yes.
Tell me, black one, have you made sometimes making her overeat, eating more than her body needs? That causes her pain. Has that been some of your doing?
No.
No. But you do cause her period pain. You do certainly hold her back. And these feelings of not being able to move on, has that been a lot of what you...
Lately.
Yeah. Yeah. Black one, tell me, who is your master? Who is your leader? Who tells you what to do? You recall?
Yeah.
All right, black one. Know that you do have helpers. You do have those who love you. One of them are animals. I call upon the whales and dolphins to swim around you. Watch and sense and see. Watch the beautiful whales and dolphins as they swim closer around you, spreading their net of light around you. They spread this net of light around you, securing you and keeping you safe. And as the beautiful whales and dolphins swim around you, securing you and keeping you safe, I just want you to feel their love and their consciousness around you. Can you feel it? Now, black one, look underneath all of that blackness. Look underneath all of that anger and resentment that you've been carrying around. There's a beautiful white light. Look and see, sense it, feel it in that white light. Check it with your own eyes. Don't believe me about it. Look, sense it, see it. I bet you never ever knew that that white light was in you. Underneath all that blackness, watch the beautiful white light as it glows brighter and brighter and brighter. How does it feel? All right. Grandpa, since we're looking at that stomach, let's just shine that stomach with a whole bunch of light, since in a way it's been abused with all of those sugars and overeating at times when the body just really didn't need it. Let's just send that stomach some love, and let's just send that stomach some forgiveness. Willing to do that? Just let that tummy warm with that love and that compassion. Good. Know that that tummy's not going to be abused anymore. That eating for Linda is for nutrition only, not a substitute for anything else. Good. Now, Grandpa, let's look now up into the lungs. Let's look all around the lungs. Look all around the liver, gallbladder. Let's look into the diaphragm. Let's look all around the heart. Left ventricle, the right ventricle. Check it out. Is there anybody there? Is there anybody stuck in Linda's heart? Now let's go up into the chest and throat area. Check all around every vein, every muscle, every tissue. How does it look, Grandpa?
There's stagnation in the throat and like sinus area.
Uh-huh. And the stagnation, if it could take on a color, what color would it be? If it had a color, what color would it represent as?
Blue.
Would it be dark blue or light blue?
Darkly.
Okay. I'm talking to the blue stagnation. I'm talking with you. Yes, we know that you're here now. We know that you've been feeling stagnant for some time, yes? Yes. Tell me, Blue One, have you ever had your own physical body? Think back. Have you ever had your own physical body?
Yes.
Yes. Were you in a male body or a female body? First thing that comes to mind. Are you a man or a woman? Boy or girl?
Man.
Yes. And you must have had a handsome male name. Your name certainly isn't Linda. What name would you like me to call you? My name is Tisha. First thing that pops into mind. First thing. What name would you like to be called? You know your name isn't Linda, is it? Although people have been calling you Linda for some time. You want me to call you... Want me to call you Blue?
Yes.
All right, Blue. Blue, I don't want you to experience any discomfort, but I do want you to go back. I want you to go back to the very last moments, Blue, when you were in your own male body, the very last thoughts, the very last feelings of being in your own physical body. Take yourself back, locate your own physical body. And then something happened, Blue. What happened to you? Discover what happened to your own physical body. As I mentioned before, maybe you can recall just seeming to slip out of that body and rise above the scene and see it lying there, perhaps. What happened to you, Blue? What took place? How did your physical body die, Blue? Let yourself recall. What happened? Let yourself remember what happened to your body. And what are the images that are popping into mind? What are the sensations? Let yourself recall, Blue, what happened. Do you remember? No? Would you like to?
Yeah.
All right. Well, how long have you been here with Linda?
About 13 years.
Uh-huh. And how have you been influencing Linda's life while you've been here the 13 years? What is just some of the ways that you affected her?
When she's nervous or tense.
Mm-hmm.
I just give her a lot of pain.
Give her a lot of pain. Did anybody send you to do this, Blue? Anybody tell you, instruct you to do this?
No.
No. Blue, I have a feeling that you've experienced a lot of pain, suffering yourself, yes?
Mm-hmm.
Where did you experience all this pain? What hurt you, Blue? What happened? Let yourself remember.
My nose was broken.
Mm-hmm. Yeah. Who broke your nose, Blue? Let yourself step back. That's only a minute before your nose was broken. What happened? What happened?
Somebody hit me.
Yeah. Someone hit you. Then what happened next?
I fell down to the ground.
Yeah. And then what were you aware of next?
It was very painful.
Mm-hmm. And then what happened? You lie down on the ground, very painful. And then what? What happened next?
There was a lot of blood.
Mm-hmm. A lot of blood, and then what are you aware of?
Just that it hurt so much.
Mm-hmm. Check and see in that pool of blood. Did your physical body lie there? And did you rise above it? Check and see. you rise above that pain and just find that the pain subsided as you pulled out of that body, check and see. Yes. Right at that moment when you saw the blood around your own body, I'm sure it must have been very frightening for you. Right at that moment, there was a beautiful light overhead. Look and see, it's there. It's right there. Look above. There's a beautiful light. And look who's in the light. Look who's come to help you in your time of need. Look who it is. It's your relative, your loved one. Someone who cares about you, watches over you, and is here right now, Blue, coming from the light. And they are absolutely overjoyed and happy to see you and be with you once again. You see, they couldn't find you where you've been hiding all of this time, these 13 years. They couldn't contact you while you've been hiding in Linda, stuck, stifled in her throat, in her sinuses. But the worst is over, Blue. The worst is over. It's all behind you now. And your loved ones are here. Who's here for you? Who is it?
Walter.
Walter. How's Walter related to you?
A friend.
Mm-hmm. Is this Walter the same Walter that is Linda's father?
Yes.
Yes. And is Walter coming from the light? Ask him. Does he come from the light to take you home?
Yes.
He has, huh? And he knew you when he was alive, yes?
Yes.
Yes.
Many years ago.
Many years ago. And he made peace when he was able to go home. And he comes back now to be your guide, your helper, to help you find your way to peace. The worst is over, Walter. Blue. And Walter's here to show you the way home. And he wants to take your hand and comfort you. You've grown quite weak, you know. You ready to go? Would you like to go home?
Yes.
Is there any message that you have for Linda before you go home to a beautiful life in the light with Walter?
That I won't pain you anymore. I won't allow you to feel that anymore.
Okay. Would you like to channel some love and light into those areas that you were stifling? And
Yes.
good. Then let yourself bless her, and you shall also be blessed. Okay. And now, Linda, I'm going to ask, is there any words that you want to say to this one, this blue one, this friend?
Thank you.
Okay. And now, Blue, holding on to Walter's hand. And Walter is here. Is there any words that you want to just tell your father, who is still watching over you, although he can help you through your prayers and your wishes and your dreams and your meditations, but only when you ask shall he be able to help you. So know that when you ask, your father can be here from the light, in the light. And he will bring you specialists and rescue workers and helpers whenever you need it. He's able to do that now. Is there any message that your dear father has for you? Listen, you don't have to repeat it. It's a private conversation. And I'm going to ask you just to move this index finger right here when you've completed this communication with your father. Take all your time you need. It's okay. Say all the things that you wanted to say. Maybe it felt that you weren't able to at the end. Dear Walter, thank you for coming. Thank you for coming. I know that you'll take good care of your friend. And Grandpa's here, and he's going to take real good care of Alexander. And I'm told that you can all reunite in the spirit world, in the place that I call home. And Blue, are you ready to go now? Only takes a short moment to go home. All right. Go now, Blue, with our blessing. Leaving in peace, leaving in life, leaving in love. Leaving now, going now, deeper and further into life. Deeper and further into life. That's right, on to the other side. That's where you'll find all that you've been looking for, all that you've been needing. And our helpers and loved ones that welcome you home, deeper and further into life. I'm going to ask you, Linda, to take a deep breath now. And Grandpa, were you able to detect, censor, perceive, see what happened to the blue one? You were able to detect what happened?
Yeah.
Okay. What happened to them? Walter and the blue one? What happened?
Yeah.
Yeah, where did they go?
They're in the light now.
They're in the light now. Good. Good. Okay, now let's just go right down again to the base of the spine of Linda. Let's check up each and every vertebrae, each and every disc. Check particularly between the shoulder blades, the back of the neck. Is there anybody there? Is there anybody hiding? Is there anybody that wouldn't want either Grandpa or I to know that you're here? This is your time to stand up and be recognized. Your time to be helped. Your time to be loved. Is there somebody here? Is there anybody?
In the shoulder.
Yeah. Tell me, are you a male or female, the one that's here in Linda's shoulders? You ever had a male body or female body?
Female.
Yeah. About how old are you? How old are you?
She's a little girl.
You're a little girl. You must have a pretty little girl's name. What name do you go by? Your name isn't Linda, is it? No, I bet you have a pretty little girl's name. What name do you like to be called? Sweetheart. First name that pops into mind.
Inga.
Inga. Dear Inga, dear child, how long have you been here?
Many, many years.
Many, many years. When did you find Linda and join with her? About how old was she? Do you remember? Yeah. Dear Inga, I've been here since she's been 10. Tell me, Inga, when you had your own little girl's body, what was that like for you? Can you recall having your own little girl's body before you joined Linda? Hmm? And then what happened to your body? What took place?
I was killed.
Yeah, how were you killed?
In war.
Were you in that concentration camp? All right. I'm so sorry that you suffered from the aggressions. It wasn't right, was it, Inga? No. And when you left that body, what did it look like? That little girl's body, what did it look like? Can you describe it to me?
Very sick.
Yeah. Very frail, very thin. Were you hungry, Inga?
Yeah.
Yes.
Dirty.
Dirty. They didn't give you any water to bathe with, did they? They didn't give you enough food. Tell me, Inga, have you been contributing to eating all those tasty foods to Linda when she was 10? Started when she was 10, you know? Yeah. I want you to know, Linda, Inga, I am not judging you in any way. I think it's important that Linda understands that a lot of what she's been suffering for
or through all of these years hasn't necessarily been all of her. And it's important that she understand this so that she can truly be healed and free, as you shall be. Because guess what, Inga? Many of your family members are here, and they come from the light, and they carry a banquet of food for you, some of your very favorite things to eat. Look into the light, Inga. Look. Look at that banquet. Boy, does that look yummy. And look who's here. Look who comes with all of that love and all of that yearning to be with you again. Look up, Inga. Look who's here. Do you see her? Do you see him? Yeah. Can you reach up and touch him, Inga? Mm-hmm. Every little girl deserves to be taken care of and loved. Every child does. Now is your time. And your loved ones are all around you. How does that feel? Feels good, doesn't it? Yeah. Would you like to go home and be with these loved ones that want you to come home now? Good. Any message here for Linda before you go home? All right. And are you willing to allow this child to go home, to be healed and be taken care of, Linda?
Yes.
Good. All right, child, hold on to your loved one's hands. Do you feel their hands holding yours?
Yes.
Yeah, they'll carry you. They'll usher you home.
Hold on to the loved one's hands. Thank you, loved ones, for coming. Take this child into the light, into the love. Leaving now. Going now in peace and love and light. Leaving now. Deeper and further into the light, little one. Deeper and further into the light. Grandpa, were you able to see this child go home to the light? Good. You're doing a wonderful job here. Let's continue now up into the head. Is there anybody in Linda's head? All right. Grandpa, I am very thankful for your contribution in Linda's life tonight. I'm very thankful for your contribution to everybody in this room's life tonight. And I know that you will be richly rewarded for the good that you have done here today. And holding on to Alexander's hand, he's been very patient for a little boy, eager to go home to the loved ones and to the playful moments that await him in the life. There is your brother here, yes, Grandpa? Mm-hmm. And I want to thank your brother, too, for contributing from the spirit world, showing you your way home. Are you ready to go, Grandpa? Good. Any last words for Linda before you go? Anything you want to communicate to her?
Just that I love her.
Yeah. And Linda, are you ready? Any last messages for Grandpa?
I love you too.
Okay. I know that the love never dies.
All right, Grandpa, look toward the light and follow your brother. He will not let you get lost, and he'll not let that little Alexander get lost. Hold on to each other's hands, leaving now, going now with our blessing, going now into the light, leaving now, going now. Thank you, loved ones, for coming. Going now, deeper and further into the light, deeper and further into the light. All right, Linda, I'd like you to take a deep, long, easy breath and exhale completely. Wonderful. I want you to know that the work that you have done here today is not only for yourself, but for those whom you have helped on the pathway home, on to their evolutionary growth. I know that as a result of this session, you will notice many improvements. Some will be quite significant, others will be quite small. Understand that these improvements that you experience will lead to even further improvements in the days and the months and the years to follow. Now what I'd like you to do is once again, find that beautiful white light that glows deep within you. That is your connection to the source, your connection to the light. Allow the light to expand gloriously all through your body. Every cell, every atom, every organ, every part of you is being flooded and washed and cleansed and healed with the light. Imagine it sparkling down into your toes, radiating out into your fingertips, glowing gently to your heart, all the way up into the top of your head and beyond your physical body, creating a beautiful aura
bubble, a cocoon of white light that lovingly surrounds and protects you. You can even turn the light up brighter now. And now sparkling down through your bubble of white light, imagine the most gorgeous color of emerald green, trickling down and sparkling down through your white light. Allow this vibration of emerald green to be applied to any part of your body that was once being hampered, particularly the area of the lower back. Allow the green light to do its healing work in your chest and in your nasal and all through your body. Every part of your body being healed and helped by the green light. And this green light will work for you 24 hours a day. And each and every time you think of this green light, it becomes more intense and more powerful and affecting you in a constructive, healing way. Now imagine a lovely color of rose pink sparkling down through your aura of white light now. Rose pink is known by some to be the color of love. It is the infinite energy, it is the abundant energy, it is the most powerful energy we know in the universe, that of love, and it is yours. It is yours, Linda, always has been and always will be yours to freely give and to receive. Now this meditation, I invite you to do at least a half a dozen times a day. It only takes a few seconds. You can do it while you're showering, while you're driving, any time at all. And each and every time you use this light meditation, you're going to find that it strengthens and heals and solidifies and gives you that deep sense of self-esteem and knowing and wisdom. It has always really been within you. It just revitalizes it and reinforces it and brings it to the surface. Would you agree to do that? Good. And I know that this experience will greatly help you in your help of others, and I feel very honored to be working with you tonight, and I thank you from the bottom of my heart for your willingness to be up here in front of everybody, and I hope that you feel the gratitude and the respect for your sharing this healing part of yourself and this private part of yourself with everybody here. We've all been enriched. In a moment's time, I'm going to have you open your eyes, and if you'd like, you can just look around the room and feel their support. And I really want to thank you. You did a great job. In a moment's time, I'm going to count from 1 to 3. Open your eyes, feeling splendid and well, really feeling good, feeling better than you have felt in a long, long time. And the number is 1 coming back now, feeling fine. 2, feel your body's position in the room, coming up, feeling good mentally, physically, emotionally, spiritually, feeling good in every way. Ready to open your eyes, feeling splendid. Good. 3. I've got some tissues for you, Linda.
Congratulations.
Did a great job. Great job. It was a good demonstration in that you could see how there were layers of similar problems that she was experiencing. The problem of not being able to move forward in her life, the problem of feeling stuck, the problem of feeling weak and afraid to move forward, all associated to various entities that were with her, the children and the ones. Now, the black entity is an area that I haven't gotten to tonight. We would be categorized as a demonic. There are several levels of demonic influence, some kind of like an army or generals, and some are just soldiers. This one was not a very strong one, although you will always find that they are here to disrupt, destroy, and create havoc in these individuals' life. When you ask the question, how long have you been with this individual, they don't know. Well, forever and ever, a long time, I don't know. They never have a point of entry. They never had their own physical body. The technique that I went through with whales and dolphins works every time. You must secure them because sometimes notice that the one, Inga, who joined at 10, who died as a result of starvation, has been with her, and you can suspect that now she will no longer have that eating obsession that tended to come back every time she really didn't try to keep it under control. So these are the exciting kinds of things that can occur, and hopefully you've all been me that sign. And I do want to maintain our commitment to get out of here at 10 o'clock, and I just want to at least give the 50 seconds. Do you want to relay anything to the audience about what you experienced?
Well, I thought maybe somebody would ask, like, what's the feeling, because you really... but I could just, like, through the whole thing. I mean, I didn't, like, feel my body at all. I mean, especially like my hands. I mean, it was like they were completely not there, part of my body, numb. You know, so.
Did you hear the end of speaking to you, or did you actually hear them, or you sensed it? Were they very powerful?
I mean, they weren't powerful, but I could hear them, see them speaking. Not like, their whole body or whatever. Maybe I'll see like a certain part of them. Yes, the colors.
Okay, well, thank you very much, and I really appreciate you being here tonight. I'm going to turn the show over to Jerry.
Dad.